The oldest recorded description of an illness like schizophrenia dates back to as early as 1550 BC from Egypt, though descriptions of episodes involving hearing voices, seeing visions, and erratic and unruly behavior began to appear in literature in the 17th century. Schizophrenia was first described by Dr. Emil Kraepelin in the 19th century. Kraepelin first used the term dementia praecox, or premature dementia, to describe the condition, and considered it to be a biological illness caused by anatomical or toxic processes that steadily declined over time. Eugene Bleuler later developed Kraepelin's ideas on the diagnosis of the condition and coined the name schizophrenia. But what does the term mean? The prefix schizo means split, while the suffix phrenia refers to the mind. Not to be mistaken for split personality, schizophrenia can be interpreted as the splitting of the mind. Though patients with schizophrenia experience a wide range of symptoms, the most common include hallucinations and delusions. Now let's dive deeper into the specifics of the symptoms. The symptoms of schizophrenia can be categorized into three main groups: positive, negative, and cognitive. Positive symptoms for schizophrenia are psychotic symptoms that are not normally there. These are new features that aren't normal bodily functions. For example, hallucinations and delusions are both considered positive symptoms. Schizophrenia patients can experience delusions of control, believing that they are being controlled by an outside being, or delusions of reference, which is where a patient may believe that they're receiving a personal message from an insignificant remark on the radio. Depending on the patient, delusions can be about bizarre or non-bizarre events. Hallucinations include having sensations, such as visual or auditory sensations, that are not actually there. Other positive symptoms include disorganized speech, such as talking in word salads, where the patient may say random words like pencil, dog, red cookie, and disorganized behavior, when patients do things that make no sense or seem to have no meaning. Negative symptoms, on the other hand, are a removal of normal processes. Often, these are categorized by patients seeming to withdraw from the world around them. These symptoms typically involve a loss in emotion and motivation. One such symptom is the flat effect, or lack of emotional responsiveness, which is also a common symptom of autism. For example, if a patient witnesses a tragic event, such as a burning building, without displaying an emotional response, this could be a sign of the flat effect. Other symptoms include alegia, or a poverty of speech, which often means providing incomplete answers to questions. If someone asks a patient if they had a fun winter break, and the patient simply replied with yes, without any of the further elaboration one would expect, this would be characteristic of alegia. Finally, cognitive symptoms affect memory, learning, and understanding. These symptoms include symptoms such as difficulty speaking, inability to concentrate, having trouble remembering things such as phone numbers and addresses. Often mistaken for split personality disorder, schizophrenia was officially added to the DSM in 1980 to provide a concrete definition for the illness. In order for someone to be diagnosed with schizophrenia, they need to have at least two symptoms, with one of them needing to be delusions, hallucinations, or disorganized speech. A common question that arises when talking about schizophrenia is what causes it. While there isn't really a definite cause for the condition, most experts agree that brain chemistry, genetics, and environment all contribute to the development of schizophrenia. One theory is that an excess of dopamine triggers schizophrenic symptoms. Dopamine is a neurotransmitter that strengthens brain signals and may explain positive symptoms of schizophrenia like hallucinations. The antipsychotic medications that have the most success reducing symptoms of schizophrenia block the dopamine receptor D2, reducing dopamine levels. However, these medications are not always effective, which fuels the confusion surrounding the cause of schizophrenia. There are also differences in the brain structure and central nervous system of people with schizophrenia, which can be seen in neuroimaging studies. Low activity in the frontal lobe could lead to difficulty in forming coherent thoughts, and extreme activity in the thalamus or the amygdala could cause the hallucinations and delusions associated with schizophrenia. Twin studies suggest that schizophrenia is also genetic, even though experts have not yet identified a specific gene responsible for the condition. Additionally, some pregnancy complications, such as malnutrition or exposure to toxins or viruses in the womb, may impact brain development and put an individual at risk for schizophrenia. Certain autoimmune disorders, like celiac disease and stress, have also been linked to schizophrenia. Schizophrenia is slightly more likely to affect men than women, and the onset for males is typically earlier than the onset for females. Some experts attribute this to estrogen regulation of dopamine. There are no differences in the development of schizophrenia across race or class. However, studies in several countries suggest that immigrants are more likely to develop the condition than native-born people, perhaps due to the stress of immigrating to a new country. There are many different approaches to explaining the causes behind and treatments for schizophrenia. Psychodynamic psychologists, for example, believe that psychotic illnesses such as schizophrenia develop because of internal representations of current relationships that cause tension as a way to relieve the tension of these relationships. Psychodynamic therapists focus on helping the patient gain self-awareness and understand how past experiences can influence present behaviors to overcome the symptoms. In contrast, humanists believe that psychotic symptoms are a distortion of the inherent ability and want to reach one's potential. Their approach to the treatment of schizophrenia starts by giving the patient courage and the belief that they can achieve their goals. They give unconditional acceptance and positive regard and hold on to the belief that the patient possesses the internal resources to overcome the illness. In the past, schizophrenia has been treated in a variety of interesting and slightly unsettling manners. In ancient Greece, Hippocrates, also known as the father of medicine, believed that mental disorders, including schizophrenia, could be treated with special diets, laxatives, and bloodletting. During the Middle Ages, schizophrenia symptoms were often associated with demonic possession, and those who demonstrated them were institutionalized in asylums or fools' towers. Examples of early 20th century treatment of schizophrenia include insulin comas, where patients are injected with insulin to induce a low glucose in a coma, metrazole shock, a type of electroconvulsive therapy where convulsions are forced upon patients using shock, and frontal leucotomy, which involves severing connections in the brain's prefrontal cortex. Today, schizophrenia is treated much differently and far more humanely. Deinstitutionalization, beginning in the 1960s, resulted in medicated, stable schizophrenics being released from state hospitals. Antipsychotic medications that block neuron receptors help to manage the biochemical causes of schizophrenia. It is important to combine medication with help from professionals of many disciplines. For example, many forms of psychotherapy, including CBT, or cognitive behavioral therapy, can help schizophrenic patients to deal and cope with symptoms in a healthy manner. Now let's look at a case study. The mathematician John Nash is one well-known individual who received a schizophrenia diagnosis. He began experiencing signs of the disorder at age 30, during which he was an MIT professor. He would occasionally vanish for days at a time, and during his lectures, he would occasionally drift off into a daydream and make seemingly meaningless remarks to his students and coworkers. Most importantly, he developed a growing paranoia to the point that he would not let guests in his office stand between him and the door, and he would always assume that someone was following him.
They're following us. Who's following us? The drop's been compromised.
Nash had been involuntarily detained for surveillance after he refused to get therapy. Treatment for schizophrenia was still in its infancy at the time. Antipsychotic medications were becoming more and more common, but older therapies like insulin shock, electric shock, and psychoanalysis were still in use. However, Nash was fortunate enough to avoid some of the previous therapies and was given the antipsychotic medication Thorazine, commonly referred to as chlorpromazine. After being confined for 50 days, he performed well and was released to go home, but during the next 20 years, he was admitted to the hospital multiple times for treatment of various mental diseases. He spent a lot of time away from his wife and children, which strained their relationship. He frequently lived in a world that was alien to those around him, yet entirely rational and everyday to him throughout this time. But it didn't stop him from working and carrying on with his life. As he aged, Nash's condition slowly improved. This was believed to be because the patient learns to accommodate their psychotic thoughts and live a better ordered life around them as they age. Thank you so much for listening. We hope you enjoyed and learned a little bit more about schizophrenia.